How would the parent know if their child is being sexually abused? Most of the time, sexual abuse is first discovered when a child tells someone what happened. Many parents expect their son or daughter to tell them another trusted adult soon after the abuse has started, but we know that most children will wait weeks or months. And many times by that time, it's very difficult to document exactly what happened, and especially prosecute the case. Abusers may threaten or convince the child not to tell anyone about it. The child may worry about what will happen and whether anyone will believe them. The child may feel that the abuse is their fault and that she will be punished if someone finds out. So these are some fallacies that we must do away with. A child's first statement about abuse may be something vague. And that's when you have to really listen to them and think about what they say. And you may not realize until later on exactly what the child's trying to tell you. May be vague and incomplete until they know how others will respond. Abused children may tell a friend first before telling an adult. Children may tell after a personal safety program at their school. Somebody may talk about it, about what happened to little Johnny, and then they realize what happened to them, and they will tell someone. Sexually abused children can have a number of behavioral and physical symptoms. Now, this is quite often that we see in the practice. Children come in with all kind of vague symptoms, and quite often we can trace these back to some type of sexual abuse. Some sexually abused children have no symptoms at all. That's probably in the majority of the case, at least not outward symptoms. The behaviors and symptoms listed below are sometimes warning signs of sexual abuse. And these are very important to think about. New fear of a person, even a parent, or certain places. Drawings that show sexual acts. Sudden changes in behavior, such as bedwetting or loss of bowel control. Sexual acts and words shared with other children or animals. Question about sexual acts that are beyond what the child knows or understands. Changes in sleep habits, such as nightmares. We had one child that came in, the parent thought that the child was having seizures. And what it was is the child was having a particular nightmare after being sexually abused. And during this time, they were in kind of what we call a hypnagogic state, which is kind of halfway between sleep and awake. And the child was so startled, she actually seemed like she was having a seizure. But it kind of, after investigation, led that there was some sexual abuse going on. Okay, physical signs of abuse may include the following. Many of these we already know. Anal or genital pain or bleeding, unusual discharge from the anus or vagina, sexually transmitted infections such as gonorrhea, chlamydia, or genital warts. One good thing now, we can check for gonorrhea and chlamydia without being invasive. Before, we used to have to do a vaginal culture, but now we have what we call the urine LCR for GC and chlamydia, which is a test that tests for the DNA of these particular organisms. And so even on a young child, if we can get a urine sample, we can test them for GC and chlamydia. And of course, the genital warts, you can see those. Parents should talk with their children in a quiet, private place. First, they can share their concern. For example, sometimes children have bad dreams because they have been hurt or touched in ways. That's pretty much like the child that we mentioned with the seizures. Then the parent can ask a general question. For example, has anything happened to you that made you sad, scared, or confused? Parents should not ask too many questions. Some abused children may decide to talk about their abuse at a later time. If you talk for something for a while and it seems that it's getting comfortable, just let it go, and then later you come back to it when you find another teachable moment. The adult should show concern and support for the child, even if the child does not say they have been abused. In this way, children learn that talking with an adult about problems is a positive experience. So what should I do if my child say he or she has been sexually abused? If the child tells you he or she has been abused, listen carefully and take it very seriously. Don't look at them angry. Look at them like, I can't believe what you're telling me. If a child thinks that they're ignored, not believed, or may be punished, they may not even mention the topic again. As a result, the child could remain a victim of abuse for months or years. If the child reveals abuse, then what steps should be taken? We know that the person should listen, let the child talk without interruption, giving them full attention. If you become sad or angry, let your child know that you are not mad at him. Praise your child for telling and show that you love and support him. Tell him you're going to find a way to keep him safe and get help. Then, of course, we have to report the abuse to local child protection agency or police according to the state law. I'm sure that most of us are what we might call mandatory reporters. If you are unsure who to call, contact the pediatrician, the hospital, social worker, whoever that you feel comfortable talking to in this situation. We tell the parents, talk with the child's doctor. He or she will let you know if a medical evaluation is needed. Sometimes the Child Protection Agency, and I'm sure you've heard about the ecology units that we have at the different hospitals, where a lot of times we just can't get it in the office. We will refer the parents to, we have one at La Rabida, I know we have one at Mount Sinai, at the different hospitals. And they can take their time, and they have people who are very specially trained to elicit this history. Most importantly, protect the child from further abuse until child protection or law enforcement professionals become involved and can provide guidance. And this question comes up, and of course, you know, you have a few people that try to deal with sexual abuse in a family without contacting the authorities. At all times, parents should not try to stop or treat sexual abuse by themselves. In some cases, an abuser has hurt or touched more than one child. If abuse is suspected, the parent should follow the steps above and get help. Then, of course, many times, and we'll do this in all this, so what will happen if we report this? When sexual abuse is reported, two kinds of investigation may begin. A state child protection agency decides whether the child is safe, and a local law enforcement agency decides whether a child has occurred. Very important point, abuse by a person who lives in the child's home, is related to the child, or works in a child care or school, usually involve both types of investigations. Abuse involving a person who is not related to the child and who lives outside the home may only involve law enforcement. After sexual abuse is reported, what happens next depends on the circumstances of the abuse. The first concern of the authorities is to prevent further abuse of the child. The child can usually stay in the home as long as their family is able and willing to protect the child. Children may live with other relatives in a foster home if the safety of the child is in doubt. These are usually temporary arrangements until the safety can be ensured. The abuser may